Your life.
Beautiful. Greetings to our distinguished panelists, our partners in this initiative, our guests for the evening, and of course, our brothers of Alpha. My name is Kevin Johnson, and I am the president of the Iota Upsilon Lambda chapter of Alpha Phi Alpha Fraternity, Incorporated, seated here in Silver Spring, Maryland. I will serve as your moderator for the evening. And on behalf of the Brothers of the Monument chapter, we welcome you to the first webinar of our spring series regarding COVID and its impact on our community. Tonight's objective is simple: to encourage continued safe and preventive habits during this ongoing pandemic. With the uptick in infections across the county and the country as a whole, staying vigilant is crucial for the health and welfare of our community. As a follow-up to our fall series, we continue to push the message that not only are healthy habits important for you, but also for the lives of the people that you hold dear. Hence the title, What Am I Bringing Home? Our brothers believe that it's critical to have these candid conversations to provide accurate and reliable information that will prompt informed decisions and effective outcomes. Tonight's primary target audience is our young adults, as we focus on behaviors that may be contributing to the latest statistics. As we move into the summer, activity levels will increase significantly. Indoor and outdoor event participation means higher risk of infection. So we'd like to explore what we can do to mitigate the risk while still living a life of normalcy. However, we understand that we cannot lose sight of what we've experienced in the last 2+ years. COVID is still here, and even with vaccines and boosters, there's still work to be done to move us away from this pandemic. So with that, a little bit about how tonight will proceed. We'll be utilizing a question and answer format, mainly to prompt conversation among and around certain topics relevant to our panelists. And with that, we're also fortunate to have some great speakers for the evening. So I'll start with some brief introductions. Brother William Adushigun is a student of the University of Maryland at College Park. He's an information science major and also the secretary of the Iota Zeta chapter at the University of Maryland. He'll be graduating this summer in August 2022, and I extend my congratulations in advance for that addition. Thank you for joining us tonight.
Thank you, appreciate it.
Brother Cameron Jones. Cameron Jones is a Silver Spring native and a graduate of Morehouse College, where he received a bachelor's in economics and political science. His background includes a diverse research of US policy and its outcomes on the global economy. He's previously worked for Children's National Health System located in Washington, D.C., as well as the Federal Reserve Bank of Atlanta. Cameron has 2 sisters, one of which is immunocompromised, which has helped him better understand and navigate his own social interactions over the past few years. He now resides in Atlanta and works at Visa Incorporated as a software testing engineer. Brother Jones, welcome and thank you for joining us this evening. Michael Smith, MD, is the director of ultrasound and senior attending physician at MedStar Washington Hospital. A native of Selma, North Carolina, Dr. Smith attended Duke University as an Andrea B. Duke Scholar and graduated with a degree in chemistry. He received his MD degree from the University of North Carolina at Chapel Hill, where he was recognized as a Board of Governors Scholar. Dr. Smith completed his residency in radiology at the University of Texas Health Science Center at Dallas, followed by a fellowship in CT, ultrasound, and MRI at UNC Chapel Hill. His lengthy list of achievements include Chairman, Radiology Department Quality Assurance Committee, and serves on the MedStar Washington Hospital Center Clinical Improvement Committee. He is a member of the American Institute of Ultrasound and Medicine, the American College of Radiology, the Medical Society of the District of Columbia, and the National Medical Association. He is also a fellow of the American College of Radiology, an honor bestowed on only 10% of radiologists in the ACR. He's been recognized as one of America's top radiologists by Consumer Reports and Who's Who in Medicine. Dr. Smith has worked with the Office of Diversity, Equity, and Inclusion at Georgetown University School of Medicine to assist in programs providing exposure and education of minority students to careers in medicine, particularly in radiology. A believer in community service, Dr. Smith helped foster the partnership between Suburban Hospital, the African American Health Program of Montgomery County, and the Montgomery County chapter of Alpha Phi Alpha Fraternity Incorporated. Collaboration includes participation in community outreach screening programs, local health fairs, and community educational webinars. We thank you, Dr. Smith, for spending time with us this evening. And finally, a request if I can. Please ensure that your microphones are muted. And in addition, if you have questions during tonight's discussion, please post them in the chat for us to retrieve. We will endeavor to answer as many questions as possible in the time allowed. So with that, panelists, I'd like to start by asking, why do you think this topic is still relevant? Brother Jones, can you start us off here? Why do you think this topic is still relevant?
Sure, Brother President, and thank you for everyone who is here. I, first of which, just want to say this topic is relevant because it has never gone away. As much as we would like to, close our eyes and wish that COVID was no longer a part of our lives, unfortunately, that can't happen. So it's as important now as it was when we first started. And I think that's dealing with any infectious disease, anything that we are still learning about. And we should just continue to be vigilant, although, we all have the fatigue of COVID and no one wants it to go on any longer than it has to.
Thank you, Cameron. Brother Adishigu, why do you think the topic is still relevant?
As Brother Jones said, this disease is still going on, still pretty relevant around this time. And as you mentioned earlier, it's only been 2+ years, so this disease is still relevant. And even though it's not as bad as it once started, it's still around, so it's still very much effective and still could spread around.
Thank you, sir. And Brother Smith.
Yes, again, first I'd like to thank everybody for joining us, and thank you, brothers, for participating on the webinar tonight. It's a great honor to be here with you all. The disease is still relevant because people are still dying from it, although at a much lesser percentage rate than what was initially had before the vaccines, and also during the Omicron variant stage and the Delta variant stage. There are still some hospitalizations and there's still some deaths. So we need to stay vigilant to do whatever we can to try to help diminish the risk to our communities that we serve. As we all know, the African American and communities of color have had the increased burden of COVID-19 as compared to majority communities. So it is incumbent upon us to try to do whatever we can to lessen this impact. So the disease is still there. It still has some prevalence. It's not going away anytime soon. New variants will probably still happen. And so we need to be extra vigilant about not only for ourselves, but for everybody else that's around us.
And to that point, Dr. Smith, can you speak to the social and health conscious decision-making in general when it comes to this virus? Your thoughts on that in general?
Well, I like to think of it sometimes. I think there used to be a game that people play. I don't know if the young people play it anymore. It's called 7 Degrees of Separation from Kevin Bacon. And it was like you had to name, if you knew a movie that Kevin Bacon was in, you could name, if you knew another actor, you can name within 7 names a connection to Kevin Bacon. And that's kind of how this virus is that it's not only that it affects an individual, but it can affect people 7 degrees of separation away from you without you ever knowing it. So the things and the choices that we make today are not just for our own benefit, but they're of the benefit of our family members, and then our family members' contacts, and so forth and so on down the line. So we could be spreading something to someone else that might not be as strong as we are, or might have a lot of comorbid conditions, and we not ever know about it. But the small things that we could do now to make sure that we can help protect our neighbor, that could possibly save somebody's life that might be 3 or 4 degrees down the road. That's what I think is still relevant, that we try to mitigate as much as possible.
Fantastic, Dr. Smith. Thank you so much for that. And I want to actually ask the younger brother if he'd answer the same question. Brother Adishagun, can you speak to its importance in general, health conscious decision making, particularly on campus as you walk around? Why would that be important?
It's very important, especially for me, if somebody being on a college campus, you have to think of the environments that you're in, especially with this virus going on. It's different for me to go out somewhere and come back to my family, where my grandmother's staying. And it's compared to me going home to, my friends, so where I live on campus. So I'd say it's very important to be aware about where you're going, who you could possibly infect with this virus and come in close contact with.
Interesting. Now, would you say that most people on campus are thinking the same, or what are you seeing on a day-to-day basis?
On a day-to-day basis, I would say I personally don't know if everybody's thinking of, the virus. Even though they emphasize masks on campus, there's still people that probably think they're overreacting about the virus. Since they've opened up campus, opened up outside, they probably might not see it as a big deal. So I feel like opinions may vary across campus.
Interesting. Brother Jones, given where we are now in this fight, do you believe that precautions should be taken when you're heading out to do events or social gatherings?
Absolutely.
What's your perspective?
Yeah, absolutely. And I think my fellow panelists hit the nail on the head. At the end of the day, it's about caring for other people besides yourself. Because even if it doesn't affect you, it may affect someone else, or it may affect, whoever they're going home to. So at the end of the day, it really is just caring about your neighbor. And I don't think we would be in the situation we were in if at the front end of this, people, in general took it a little bit more seriously and not only just focused on themselves when it was in their own home, because that's how a lot of people, deal with things is it's not a focus until it's personally affecting me. But I don't think that we would be in that situation had we all taken a little bit more precaution on the front end and just done our due diligence and, washed our hands and worn our masks, even when we didn't really feel like it.
But Cameron, it's been over 2 years. I mean, everybody is vaccinated and boosted. I mean, can't we relax a little bit, or what?
Well, to that, I'd say I just echo the same sentiment of Dr. Smith. People are still dying. People are still being hospitalized. This is not a common cold. We talk about all of the comorbidities, and, people have lifelong lasting effects after this. If you have a respiratory problems before this, it'll only extend it and make it that much worse. So I don't see COVID going away anytime soon. For me personally, in my own life, I see myself wearing a mask even to the grocery store. Any high densely packed area. I think this is something that will just kind of become a part of our new normal.
And you're actually down in Atlanta, correct?
Absolutely.
Is that what you're seeing in the grocery stores, or?
Yeah, so in the grocery stores, absolutely, but other parts of Atlanta, not so much. So if you're more on the younger social scene, no, you aren't seeing as many masks. And part of that is kind of disconcerting, because Atlanta has always been a hot spot for COVID, from the very beginning, because it's just not being taken as seriously. And, part of it is the message that's being sent down here is not necessarily the same message that's being sent straight out from, even though the CDC is down here, it's not the same message we're getting back home in DC and Maryland. So it's just, you have to take it upon yourself to, protect yourself and protect those around you.
If I may add to what Brother Jones just said, it's problematic that people's vision of the virus 2 years ago tended to be somewhat more political than medical. And that's still what's permeating today throughout a lot of our society. A lot of the southern states, to be quite honest with you, have never really taken the mitigating strategies, the mask wearing, getting vaccinated as seriously as some of the West Coast and some of the Northeast that we have. And we all saw the news, a year ago when they were just had devastating impacts on our healthcare system and their communities when we couldn't get PPE equipment, when the hospitals were at a peak and they couldn't have nurses and doctors even available to take care of the patients that they had. And it's unfortunate, like I said, that the science got clouded into the politics. And that only comes from a leadership, the leadership in each state, the leadership in our federal government. As I say, the fish rots from the head down. So I encourage my friends to try to stick to the science, my family, to stick to the science, and let that be your guide as to what you should or shouldn't do or should or shouldn't consider, and not just the political back and forth that happens on some of the TV channels.
Great comment, brother. Brother Adishigun, do you think you're seeing a new normal as you walk around your community, on your campus, or is it status quo from 2 years ago? How would you describe what you feel, what you see, what new normal is for you?
I feel like the new normal is for me is at least, I think people have kind of accepted that the virus, is here, and it's here to stay. It's not going anywhere, and you kind of have to adjust your lifestyle and how you live, kind of around the virus, and certain things that you may have done before the virus, you kind of think about, and you're kind of like, oh, maybe I can't do this as much now because of the virus, and what may possibly happen if I do this, and how it could impact others.
And with the recent uptick, how do you think you should be approaching this current phase of the pandemic?
I feel like people should just continue to do what like they've always been doing, especially with the CDC, all the requirements and all the things that they've been asking of us. Wash your hands, wear a mask, social distance. I still feel like people should still take those precautions to help mitigate the virus as much as possible.
Fantastic, thank you. Mr. Jones, you spoke earlier about your sister, I believe, that was immunocompromised.
I did, yes. So my youngest sister is actually a recipient of a heart transplant. So that brings lots of medical difficulty, but it also just made me really think about, what am I bringing home, to bring in the title of our webinar tonight. It made me think about, how often I wash my hands during the day. It made me think about, whether I go out, and have a good time with my friends, where are we going? How many people are going to be there? The kinds of questions that your mom used to ask you, where are you going? Where, who's going to be there? But those are things I started thinking about myself, where it was really, am I putting myself in a position that I could be unintentionally harming my own family members? And, thinking about that, thinking back on that scenario when I was still living, right next to my sister, I would never want to put my own family members, in jeopardy. And then I thought, well, if I wouldn't want to put my own family members in jeopardy, why would I want to put anyone in jeopardy? Why would I want to put myself in jeopardy? And, moving forward, I've just made it, I keep a mask. I make it very, very easy for me. I keep fresh masks by my car keys. I keep, a little post-it note that just says, remember to wash your hands, just daily things. As much as we've built it into our lives, I don't think we're so much navigating around COVID in our lives as we're just bringing it in and integrating it into our lives. Because I don't think it's really a big ask to just remember to wash your hands. And I know maybe some people think that masks are uncomfortable and what have you, but I really don't see it as a life-changing thing to put your mask on.
Are you seeing different behavior down in Atlanta versus when you were up here in Silver Spring? And if so, can you?
Yeah, absolutely. If I live in Midtown, so if you walk down the street, maybe 50% of people are wearing their masks. And I know we spoke about the politics side of it beforehand, but I think some people are also just kind of over it, and you can't necessarily just be over it. And like I was saying earlier, close your eyes and wish it away. I wish things could happen that way, but that will only, in the end, put you closer and closer to, contracting it or passing it on to someone else.
Brother Adishigun, how difficult is it to talk to your peers and or your classmates about this on a campus like that of the University of Maryland? Is this something that you find yourself doing consistently, or do you approach it a different way? Or
I feel like for me, it's not, I would say it's not a conversation that people really bring up on campus. Our campus has our guidelines in place already. Wear your mask in the classrooms. If you're eating, you can take your mask off. There are certain areas where you have to keep your mask on campus, as well as like the student center. There's certain areas in the student center where you have to keep your mask on. But overall, I don't think it's much of a conversation that people really have. I feel like people have kind of accepted that COVID is here. The guidelines are here on campus, so we just have to follow them and make sure for yourself, you don't try to get infected or infect anybody around you.
thank you. And Dr. Smith, can you actually speak to the effectiveness of the guidelines that we're seeing now? Masking, washing your hands, especially on a campus of that, whether it's Georgetown or University of Maryland or Morehouse in the case of Brother Jones. How effective are the guidelines as we see them today?
Well, in most cases, if people follow the guidelines, they are fairly effective at mitigating. Obviously, the best thing to do is be vaccinated. Mask wearing is very, very important as well, as both brothers have said earlier. And the hand washing, social distancing when possible, all those things that came about before the vaccine are still very important, and they do help decrease the spread if still followed. However, I think people are, as Brother Jones and Brother Adishigun kind of mentioned, that people are a little COVID weary, and that there's a lot more acceptance of it's out there. I'll just have to deal with it, but I'm still going to live my life. But you can still live your life and still be protective. I agree with Brother Jones in that, to me, is wearing a mask is just not a big deal. I guess I wear it so often in a hospital anyway that it's almost like wearing my glasses. I feel like I'm a little naked without it, So I'm just used to it. But as far as people's choices and what strategies they still want to employ and not employ, I'm going to go back to trying to follow the science. I admit it's a little confusing. The CDC has changed its guidelines recently for community levels of spread. A couple of months ago, 3 months ago, they were using positivity rates as the directive for their guidelines. And now they've recently changed to a new paradigm to classify counties around the country into low, medium, and high as far as risk factors are concerned. Those new guidelines are based on things that are actually more relevant. The new number of cases in your community per 100,000 individuals, the new number of hospitalizations in your community per 100,000 individuals, and the number of hospital beds that are taken up by COVID patients. So they have these three parameters that they look at, and then they have a scale that they'll put it in, and they'll classify your county as to low, medium, and high. Since we're in Montgomery County, IUL's in Montgomery County, we're currently listed as medium as far as community spread level. So basically the recommendations are, if you're in a low county for community spread, that you just need to stay up with your COVID-19 vaccines and to get tested if you have symptoms. But there's no other really mandates from the CDC as far as anything else. For counties that are in the medium category, like IUL, it depends on if you're coming into contact with people that have are predisposed to severe illnesses. Brother Jones mentioned his sister who has a heart transplant, people with the chronic illnesses that we all know about, people that are on immunosuppressive drugs, those type of people. Then you should take the precautions and wear your mask when you're around those people, 100% of the time, if you're around those type of people, because even if they get something, they really aren't in a position to fight it off. Again, stay up to date with your COVID vaccinations, including the boosters. If you are not allergic to it, it can have it. And then something else that's kind of a little bit going by the wayside now is to get tested if you have symptoms. Testing is easy now, particularly home testing. You can get free home tests from the government. I'm sure everybody has seen the websites that they put out a few months ago. And now, just this past 3 weeks, you can get a new set of home COVID tests from the government, from the same website. So if you had your COVID test from a few months ago, now you can order a new set and get eight home COVID tests. So they're making it very easy for you. And I think that's falling by the wayside because sometimes you don't know whether or not you have it or not. If you had a high exposure to somebody, just test yourself and see what you have. For communities that are in the high level of community transmission, you should wear your mask if you're indoors in a public environment, where you don't know the other people, you don't know their vaccination statuses. Just wear your mask. Again, hopefully stay up to date with your vaccines and get tested. And if you're around other people that have, again, serious, severe illnesses or complications, then you should be extra careful and even get tested. Even if you're thinking about visiting somebody else that's in that category, just take a home test before you go, so you know where you stand. So
That's
those are the things I think.
I want to follow up with a question, and this is for all three, but obviously with MD behind your name, you have some more credibility with friends and peers and what have you. But when speaking about vaccine hesitancy now versus 2 years ago, how do you approach that with friends, with family members, with peers that are still in that space, if at all?
Well, that's actually, Brother Johnson, that's a challenging question. For most people that are going to get vaccinated, they've gotten vaccinated by now, right? They've gotten vaccinated, they've got the second dose. Now I'm referring to the Pfizer and the Moderna. The J&J is kind of fallen off as far as primary recommendations now. So for the Pfizer and the Moderna, they've gotten it. The booster shots are kind of hit and miss a little bit. For Montgomery County, we've only had about 55% of the residents in Montgomery County receive a booster, but we're at over 95% of residents that had their initial shot, either Moderna or Pfizer, and 87% have had their second shot of Moderna or Pfizer. But then we fall down to 55% with the boosters. Again, very important for people that have pre-existing or pre-morbid type conditions, those that are immunocompromised. So to answer your question though, to have that conversation with friends and relatives, the people that are open to it, pretty much, at least in our area, have pretty much been vaccinated. The people that are not, sometimes their views are a little misguided, and then there's still a distrust in the government, from what happened a long time ago with the Tuskegee experiments, those type of things. There's I call it the Facebook information that goes out about people planting some type of electronic devices in the vaccine so they can monitor your whereabouts. There's all kinds of craziness. I don't even remember most of them. So it's hard to convince people at this stage to go ahead and get the vaccine, particularly when they survived through the Delta variants and 2 of the Omicron variants. And even though the percentages are ticking up slowly now, they're not at the same levels that they were previously with Delta and the first 2 Omicron variants. So I just try to present them with the medical facts. The vaccines are proven to be very, very effective. They've proven to be very, very safe. They've been tested on millions of people now, throughout the world and the United States. You're not going to get a bigger clinical trial than what's happened with these vaccines now. So I try to give them the medicine, the science side of it, answer any questions that they may have, and you just kind of have to let the chips fall where they may, unfortunately.
Thank you so much for that. Brother Jones, same question. Out and about with your friends, colleagues.
Yeah, Dr. Smith hit the nail on the head. I think the people who trust the science already have it. And I think those who don't, I will, he didn't say it, but I'll go ahead and call it willful ignorance. I know we probably all remember back 2 years ago when it first started and people were dying with, a much higher rate. There were stories of people on their deathbeds who weren't vaccinated, all of a sudden asking for a vaccine. And it's too late at that point. So I will call it willful ignorance because there's science and there's pseudoscience, there's Facebook science. I would like to trust the scientists and the doctors and the people who have gone to school and dedicated their lives to understanding these things rather than the Facebook groups.
Absolutely. And Brother Adishu, same question with a twist. If you have a couple of family members that you have to speak to, is that challenging? Do you do it at all? Or what do you think an effective approach is, if there is one?
I would say the most effective approach would be to kind of provide the situation, for them to think more of their other family members, their the elderly people in their family, the younger people, kind of think about them and how them not getting the vaccine could affect the people in their family and even themselves. You may not catch the virus now, but like down the line, you may be able to catch the virus. So just thinking about the people around you and the environment you're in.
And we've also heard the terms asymptomatic versus symptomatic. Does that play a role in your decision making? Any influence on where you go, how you interact with folks? What do you think?
I think as far as asymptomatic and symptomatic, it shouldn't really matter. If there's a situation, if there's an area where people are catching the virus, then you should be wary and cautious of, going to certain areas or even being around certain people, because you never know, especially with asymptomatic people, you really never know if they have the virus or not. So you should always be cautious.
And just to add on to what my brother was saying and what Dr. Smith was saying, the prevalence of taking, tests has gone down, but I don't think that it should stop. I think, maybe once a month, even if you don't do it more than that. I think it should just be something we do going forward, because you don't know, even if you are asymptomatic, even if you do have your vaccines. I think it's better to know your status or know if you have it than to not, and to just operate like, everything is peachy keen.
Yeah, I agree. I think testing is going to be the key for asymptomatic. You're not having symptoms. So why would you get tested? Number one, you should just get tested just to see kind of where you stand. Number two is if you've had an exposure to somebody else, the serious exposure to somebody else that does have the virus, then you should get tested. By definition of serious exposure is within the 6 feet distance, less than the social distancing for 15 minutes or more. And those don't have to be consecutive 15 minutes. They can be different pieces of 15 minutes, but you were within that person that has now contracted the virus, and you were less than 6 feet away. So you should definitely get tested if you're in that type of situation. So, for people that are symptomatic, regardless of what your vaccination status is, you should stay at home, stay at home for 5 days. If your symptoms resolve after 5 days, you can leave your house, but you should wear a mask for another 5 days if you had the virus. Always wear your mask around other people for that additional 5 days. And if you're still having a fever, you have to stay at home until your fever is resolved. You want your fevers to have resolved for at least 24 hours without taking antipyretic drugs like Tylenol. So you want to be fever free before you start counting that additional 5 days when you can wear your mask. If someone has just been exposed to COVID-19, again, it kind of depends on whether or not you've been boosted or not, or completed the Pfizer and Moderna. If you have, you should wear a mask around other people for about 10 days and do a test. Again, sometimes people make the mistake of testing a little bit too early if they had an exposure, because you can get a higher percentage of false positives and false negatives, more false negatives, because of the incubation period of the virus itself. So the optimal day for testing is around day 5 after an exposure. I had an exposure week before last, and I tested on day 2, then I retested on day 5. The PCR test from my hospital and also a home test. Day 2 was probably a little early, but I kind of wanted to see, because if it was positive, then I couldn't go to work, so, but ultimately at day 5. So again, take home messages. The tests are free. The government's giving us the test. It's out there. Take it and see where you are, and then react accordingly. So, after, if you completed all your vaccines, so after day 5, you can again go out, but you should wear your mask for an additional 5 days. If you can't quarantine at all based on what your profession is, then you should wear your mask for a total of 10 days. Again, if you want to test early, feel free to, but then test again on day 5, because that gives enough during the incubation period to get a better sense of a true positive or a true negative test.
And thanks, Dr. Smith. And I want to come back to you with this question, so I can ask the young brothers first. But we want to ask what you think the future holds with respect to this and our health overall, whether it's boosters every 3 months, 6 months, or no socializing or what have you. So, Brother Adishu, what do you think the future holds for us with respect to this pandemic?
As far as this pandemic goes, I believe that masks will start to become a part of our lives now. Anywhere we go, they'll most likely require you to wear a mask inside. And as far as vaccines, I feel like that'll also become a part of our lives as well, getting it regularly. Even now, like getting vaccines before you're able to go to school, that's required. So possibly in the future, they could require, getting a COVID vaccine before you're allowed to enter school. So I feel like that's where we're heading, the direction we're heading in.
Brother Jones.
Yeah, I would echo that same sentiment. If you look at, parts of Asia where most of their populations were wearing masks even before COVID. And I know that they have different air quality and there's different reasons why they were wearing them. Excuse me. But I think it is going to be part of our new normal, just wearing the masks in large spaces. And I think moving forward, even without COVID, it kind of is a good idea. And I will say that part of COVID opened my eyes up to, hey, there really are germs everywhere. And it's not something that it's not something that the average person thinks about. It's like, hey, wow, like I was, sitting down at a table that might not have been wiped very cleanly. Like I was, interacting with all these people, and I was, touching my face, or I was touching my hands, or I was coming home and, touching small children, those kinds of things. Where I think it just really made me conscious about just being more health focused, about washing my hands more often, about keeping the mask. And like Dr. Smith said, even getting the tests. So I think we should, willfully accept this as part of our new normal, but it shouldn't scare anybody. I think these are precautions that any health conscious person really should have been taking in the first place.
Very interesting perspective. Dr. Smith, I mean, I'm seeing folks going to football games with 50, 60,000 people, no mask. Basketball games where they're indoors, 20, 25,000 people cheering for the teams, no mask. Given that, and those that are diligent about their health, what do you think our future holds with respect to this pandemic and how we approach it to remain healthy?
Yes, great question. I think the COVID is here to stay. I think it's going to become a new norm if it not already has for most people. And my guess is in the future it's going to be treated like the flu with yearly vaccines, that type of thing. I just like to say too that it's interesting that because of the mitigation strategies that people have implemented for COVID, i.e. the hand washing or mask wearing, the incidence of flu, people catching the flu the past year or so has been decreased. So those generally good health strategies can affect us from more than one disease. It can help us in many ways. It's just good care, wash your hands, wearing the mask is not necessarily a great thing, but it's not that terrible thing. Be careful around what you do. So it's helped us. As far as like the large events, the public gatherings, people have their own level of thresholds, risk thresholds for what they want to do. Obviously, outdoor events are much safer as far as COVID spread than indoor events. So when I go to a football game, I still wear my mask, even though we're outside at like the Ravens game. Not many people in the stadium are wearing their mask, but it makes me feel more comfortable. And so nobody's never saying you can't wear your mask. It's just we don't have a mask mandate, but you're always free to wear it. Indoor events are much more risky, and we have to be honest about that. Basketball games, hockey games, clubbing, where people are dancing around and breathing hard, without their mask on. Those are areas where the spread of the virus is easily done, to be quite honest with you. So, and I think people have to take their own risk profile into consideration when they make those choices. Again, there's no mask mandate. I think the businesses are glad that they can open back up and have people in. That's their livelihoods. That's understandable. But hopefully people can think about what we talked about at the very first part of the webinar, that this is not just about you. It's about other people as well. So when you make those decisions, particularly about people that you're going to come in contact with on a regular basis, somebody at home that may be a bit immunocompromised or maybe elderly. You're going to go visit your old grandmother or old grandfather, knowing that you've just been out partying hard, in the club. You might want to think about that and put that off for a few days until you can make sure that you don't have the virus. Or if you do have somebody that is severely immunocompromised, that you, again, put out the visit for a few days, take a test, before you think about going to visit them to make sure that you're negative. So even though it's the new norm and people are going to have personal choices to make, I still think we need to be careful when we think about others and not just ourselves.
That brings me to a great point and hopefully a great question. Brother Adeshigum, do you feel any social pressure? Does that play a role as to whether you wear a mask or not, or do some of the things that have been promoted over the last couple of years? especially
I
when
feel,
you're out with your friends doing these different social activities?
I feel like for me personally, there's not really any social pressure. I personally decided to get the vaccine. I know COVID is a big deal, and I know the environment that I'm in. I have my grandmother here at home, my little brother at home, so they could potentially be at risk for this disease. So I always make sure that I try to take the precautions whenever I go out, so I don't bring anything back home to them.
Absolutely. Brother Jones, same question.
Yeah, so my workplace actually mandated that we all be vaccinated. So that's where I spend the majority of my time when I'm interacting with coworkers. I can, have, the peace of mind at least that everyone in this building, on this floor is vaccinated. Socially, going out, I do live in Atlanta. People aren't always wearing the masks, but it's just me making my own decision to wear mine when I go into the grocery store, when I walk down the street, and it doesn't cost me anything.
Dr. Smith, do you feel that's real? Social pressure to wear one or not wear one, especially when you're out in the grocery stores or in a club or in a restaurant?
I wouldn't necessarily say I call it pressure, but I do think there's some social stigma depending on what part of the country you're in. When I go back home to North Carolina and I'm wearing my mask, I go to the local Walmart, man, they're looking at me like I got 4 eyes or something. Up here it's not a big deal, right? People wear the mask and you just go and come as you please. But down there in small town North Carolina, again, part of it is political, but mask wearing has a stigma. And so it's not direct pressure because these aren't my friends or people I interact with, but you know the look when you're just walking around the grocery store, walking around the Walmart, and nobody else hardly in the store has it. But one thing I do find interesting now is that at the start of this pandemic and even after vaccinations, we were worried about, and then even the part of this conversation, what are we taking home, right? How do we protect the people that are immunocompromised, or how do we protect people with families that have young children? Remember, that couldn't get vaccinated early on, So that's something that we need to talk about. In my hospital, we have all the precautions, the PPE. Before the vaccines came out, man, everybody was wearing gowns, gloves, masks, shields. You can only see like your eyes. That's the only thing you could see. You were glowned up all day. And after the hospitals, of course, in our area, like Brother Jones' workplace, vaccination is mandatory for you to work in the hospital, and mask wearing is also still mandatory at my hospital. So you still feel pretty protected. But what's happening, interestingly, before the mode of transmission throughout our departments and our staff, when patients come in, they come in sick with COVID, we're taking care of them. And even though we were taking the precautions of, the PPEs, masks, and everything else, we were still catching COVID. The doctors, the nurses, the technicians, we were still catching COVID. And it was, everybody's heard all the big news stories about the crush that was happening in hospitals from the volumes of patients coming in, and also that we didn't have the staffing to really care for them adequately because the staff themselves were coming down with COVID. But now what's interesting is that the vector for COVID spread coming into my hospital now is not usually the patients, it's people that have contracted it from home. Those same little kids we were trying to protect before, those are little kids that are coming down with the virus now and giving it to their parents who are now coming to work, in the hospital. So it points back to, again, what we were saying, that the vector of spread, you never know where it's coming from. And it's still out there in the community. So we have young kids that couldn't get vaccinated. They're catching it. They're going back to school. So they're catching the COVID, giving it to their parents. The parents are coming into the hospital now and potentially giving it to coworkers in the hospital. Just last week, we've had two of my colleagues, two physicians. One came down with COVID. One had a serious exposure with her husband with COVID. And we had one of my ultrasound technologists that did come down with COVID, who was actually fairly sick for a few days. And they got it from her youngest son, who was going to school. And that's why I mentioned earlier that I had to get tested, because we do procedures together, biopsies together. So we were around each other for extended periods of time as we were working on other patients. So the vector of spread has kind of come full circle. It's like we were catching it from patients, and now don't bring it home. But now it looks like, well, home people are catching it from different sources, school, whatever. If you have a young adult in your house, they might be out again socializing, and then bringing it back to the hospital. But again, the point is that we still need to be careful. We still need to be vigilant. The stigma up here is not a stigma up here for the mask wearing, the mitigation strategies, but we still need to be careful. And if I may I say one other thing, Brother Johnson?
Oh, absolutely, Doctor.
Yeah. I'd like to remind everybody that there's still other things we can do besides getting vaccinated and the mitigation strategies. We still have other drug therapies that are out there now that we didn't have before. The monoclonal antibodies. We still have antivirals such as Paxlovid by Pfizer, which you can take in pill form over a 5-day period. But the key to both of those, the monoclonal antibodies, the Paxlovid, is to catch your disease early, right? So the directions are they are effective if you catch the disease within the first 5 days. So if you have symptoms, going back to the same thing we've been talking about, get tested. If you have symptoms or if you have a serious exposure, get tested. And if you do come back positive for the virus, then there are some other therapies we can do to help you. The monoclonal antibodies, it's an infusion, or the Paxlovid, which are pills. One last thing, for those that are severely immunocompromised and might not be able to take the vaccine, either due to allergies, or even if they can take the vaccine because their vaccine is not going to be as effective for them because they're on immunosuppressive drugs, and then they can't generate the antibody response from the vaccines like normal people would. So there's a medicine called Evusheld, which is specifically provided for that subcategory of people to help in COVID prevention. So it provides them with some antibody protection that their own body is not able to do because they're on immunocompromised or immunosuppressed, transplants, collagen vascular diseases, so forth and so on. But again, the key to it is to, well, not for the Evusheld, is the prevention. So you shouldn't be COVID positive when you ask for that, but contact your healthcare provider. Like politics, healthcare is local. Contact your healthcare provider, ask questions, get advice. Don't wait to the last minute. Have a strategy already in place. It's like if I do come down with COVID, I should already know I can do X, Y, Z, 1, 2, 3, boom, 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 and have it ready in place. If I have a serious exposure, these are my options. Contact my doctor, and I can do X, Y, Z, 1, 2, 3. Don't wait till you have it or have the exposure and then not have a plan in place. We can all have a plan in place now to make it very easy for us later on.
Fantastic recommendations, Dr. Smith. Thank you so much for that. And great segue into the last question for the other two brothers. Brother Adeshigun, any closing thoughts, any feedback on the conversation tonight, or what are your takeaways? Anything that you want to offer?
My biggest takeaway is to, just be mindful of, what's going on around us. Obviously, the world's moving at a fast pace nowadays. So people may not think about the virus as much as they used to think about it 2 years ago, but, it's still around. So we should always be mindful of that and take the precautions that we need to take so this virus doesn't go back to where it was 2 years ago, or maybe potentially worse than what it was before. So.
Thank you, sir. And Brother Jones.
A great man once said, "Love thy neighbor as you love yourself." And I will end it with that.
Fantastic. And Brother Smith, if you close for us.
Well, thank you, Brother Johnson. I really don't have more to add than what we've already discussed. I think Brother Adeshigun and Brother Jones gave great insight into what younger brothers in the college campuses are feeling and doing. And actually, I'm a little surprised that they are as conscientious as they are. That's great. That's great. Makes me feel a lot better. But the take-home message again is it's not just about you; it's about others in the community. So even though you might feel a little inconvenienced in some of the mitigation strategies, and even if you catch the virus, you probably might have milder effects now, but there are others where it could be life-threatening. So think about others in your community, others in your family, and react accordingly. So that's probably the take-home message. It's about others, not just yourself.
Great way to close, Brother Smith. Thank you so much. And I want to thank all of the panelists this evening for joining us for this fantastic conversation. I've learned a lot, and hopefully those that are participating have learned a lot as well. I also want to thank our partners. We have a group of organizations that support us, in addition to, of course, the Black Physicians Healthcare Network and NCCF, the National Center for Children and Family. Without their support, we could not do webinars like these, have conversations like these, and ultimately influence the narrative. So thank you to the team. Thank you to our partners. And most importantly, thank you to our audience. Thank you for spending your time with us this evening. And with that, I will bid everyone good night. Take care, team.
Thank you, everyone.
Thank you all.